Hi, this is your pharmacist, and today the topic we are going to discuss is upper respiratory tract disorders. The first one is common cold. It affects your nose and your throat. The symptoms typically includes runny nose, sore throat, cough, watery eyes, sneezing, and congestion. There is no cure and there is no vaccine for common cold because there are many strains of virus, close to 250, and rhinovirus being the most common virus. How you will treat the common cold? The treatment is basically symptomatic. Antihistamines, decongestants, cough suppressants, and expectorants are basically given in common cold. There are multiple combination of products available in the market. For example, Claritin D, it is a combination of antihistamine and decongestant, which contains loratadine, which is an antihistamine, and pseudoephedrine, which is a decongestant. When patients are taking multiple products, they do not take what product contains what ingredient, what active ingredient. So they must closely see that which therapy they are taking because taking multiple products having the same active ingredient will cause the duplication of therapy. So the best thing is to avoid that and closely see the product label. And there's a thing that decongestant can raise your blood pressure. So when using cough products, read the label carefully and talk with your prescriber or doctor. The first thing is antihistamine. The first you say your for the treatment of common cold. So it will relieve your symptoms. For example, nasal secretion, itching, sneezing, and coughing. Itchiness and redness are from allergic reactions. Antihistamines are also given for mild insomnia and relaxation that is prior to anesthesia. So if you're having symptoms of nasal secretion, itching, sneezing, and coughing, then take antihistamine. People who have allergy from dust, so they can also have antihistamine. The mechanism of action, how it works, it will block your histamine H1 receptor that causes capillary leakage and dilation. Capillary dilation and leakage. So first generation histamines and there are second generation antihistamines. First generation includes chlorpheniramine, clamistine, and diphenhydramine. The first two are oral, but the third one, which is diphenhydramine, it is oral, IM, and IV. First generation antihistamines, they tend to cause the most sedation. I'm sorry. First generation tend to cause the most sedation, and second generation, for example, cetirizine, desloratadine, fexofenadine, and loratadine, they do not cross the blood-brain barrier, and so they do not cause sedation. You need to memorize that. First generation includes chlorpheniramine, clamistine, and diphenhydramine. But second generation includes cetirizine, desloratadine, loratadine, and fexofenadine. First, cause the most sedation. Second, do not cause sedation. So if you have uh, your job that is more related to alertness, mindfulness, then do not take first generation. Prefer second generation. Side effects that are associated with antihistamines are drowsiness, dry mouth, urinary retention. So what are the cautions? Avoid alcohol at best practices. If you're having urinary problems or prostate enlargement, then avoid antihistamines. Precautions are like patients who have high BP and they have heart problems, talk with prescriber before taking antihistamines. And these antihistamines are not for infants and not for breastfeeding women. Patients that are having glaucoma and those who are on therapy of monoamine oxidase inhibitors, they should avoid antihistamines. So now comes to decongestants. So to treat the upper respiratory congestion, decongestants are given. They will treat your pain that is caused by common cold, sinus infection, and allergies. How they will treat? They will reduce the sinus and nasal tissue swelling and allow for better drainage. Commonly used decongestants are phenylephrine and pseudoephedrine. Side effects are headache, dizziness, lightheadedness, insomnia, nervousness, and nausea. Sneezing and nasal irritation can happen while you use topical preparations of decongestants. Serious side effects are high blood pressure and irregular heartbeat. What are the contraindications? Phenylephrine with high BP and tachycardia, and pseudoephedrine should not be used with or within 14 days of monoamine oxidase inhibitors therapy. Pseudoephedrine is available over the counter, but it is not available in excess quantities because many use pseudoephedrine for the illegal manufacture of methamphetamine, which is an illegal drug, which is an ice. So when you demand in excess, you should tell the name or the doctor, or they can ask you for your signatures as well. So there is a thing with methamphetamine. Cough suppressants, they are used when the cough is excessive and it is non-productive. Non-productive means not having mucus. It is dry. Chemical structure of dextromethorphan and codeine is similar, but it is not having pain relieving and addictive properties. They are saying about dextromethorphan. Hydrocodone and codeine, they suppress cough as well. And how they will act? They will suppress the cough reflex in the medulla. So cough suppressants are normally given when you are having excessive cough, but it is non-productive. Dextromethorphan, codeine, hydrocodone are used. Expectorants. So they are used when the cough is productive. Productive means wet and mucus producing. How they will work? They will liquefy the respiratory secretions to allow them to be excreted easily. So they will ease the secretion. Suppressants include codeine, dextromethorphan, and hydrocodone. Side effects are drowsiness, dizziness, and upset stomach. Cautions are like you have to avoid the alcohol while you are having excessive drowsiness, because if you take alcohol and suppressants, it will cause excessive drowsiness and it will intensely it will slow your breathing. And expectorants includes guaifenesin. The brand names include mucinous and robitussin. The side effects are it will upset your stomach and it will cause headache. Rhinitis is the other upper respiratory tract disorder. Rhinitis means runny nose. It can be acute, it can be chronic. Acute rhinitis is self-limiting, it will recover itself, and the treatment is symptomatic. But in chronic, it is caused by allergic and non-allergic sources. Allergic sources, for example, dust, pollen, pet dander, and cigarette smoke. And non-allergic resources include irritant odors, temperature change, and alcohol consumption. So for rhinitis, we use antihistamines and decongestants are used. When a cold produces symptoms of stuffy nose and sinus pain, then we use decongestants. Nasal antihistamines and corticosteroids are also used. It will reduce your inflammation, that is psoriasis, and allergy symptoms. Isolastine is a antihistamine, but beclomethasone, budesonide, cyclisonide, flunisolide, fluticasone, mometasone, triamcinolone, they are nasal corticosteroids. So what are the cautions with nasal antihistamines and nasal corticosteroids that you need to shake the container before you use the medication like inhaler or nasal spray. Why? Because it will homogenize the contents that are in the product. And prime the container means if you have a new spray or a spray, then you need to prime. Like first, push the like push the sprayer not close to your nose, but away from your nose and spray it in the air. It will prime your container. And when you will use the container after that, then you can use it like normally. If you are not using the product for a time longer than 14 days or 10 days, then you also need to prime your container. It also a caution with many products. So we have learned about common cold and what medications are used and how it will treat your symptoms. The treatment is basically symptomatic. So we use decongestants, expectorants, and antihistamines. For example, acetaminophen we talked about, pseudoephedrine, epinephrine, dextromethorphan, guaifenesin. So these are all the things that I want you to remember that antihistamines are given, decongestants are given, cough suppressants and expectorants. Whatever symptoms you are having, they will treat you on the based on the symptom. And these medicines are available on the counter and you can have them and it will ease the difficulty of having the symptoms. Treat the common cold and it is sometimes self-limiting, it is sometimes need treatment. So now we know the many medicines. And if you have ever chance to go to the pharmacy, then see what over the counter common cold medicines like antihistamines, decongestants, cough suppressants, and expectorants they are having. I hope you have liked my lecture, my presentation, my practice. So if you have learned something, then kindly subscribe and like my channel, and you can ask any question. It is totally from a book that is for allied health professionals, and you can learn it by your heart. And it is the most common questions that people ask when you go for an interview in retail and community pharmacy. Thank you. Have a good day.